For all the joy, the reality also is that this is just the beginning of a road to recovery. And I'm joined now by one of the people helping those freed hostages, the head of the health team for the Hostages and Missing Families Forum, Dr. Hagai Levine. It is good to see you again, Doctor. At first, what can you tell us about the physical conditions of the released hostages, 20 men, ages 21 to 48?
I can share with you at the moment what the families disclosed. And the families are just starting to reveal themselves and to reveal to the public the atrocities that some hostages were completely isolated for the entire period, 738 days. Hostages were cuffed both in their hands and legs without ability to move. They had out torture, really hell torture. The brother of Matan, Andres, revealed that Matan was cuffed to a balloon gas that could explode at any moment. So imagine what it has been like for him mentally. And we are starting to understand the health implications. And many of them suffer chronic pains that was not treated. Some of them have handicaps that may be irreversible, such as to their musculoskeletal systems, to their hands with burns. And we still don't know what is the impact on their essential organs. We have seen that they lost a lot of weight, although some of them were fed over the last weeks, but still they lost 30–40% of their weight, with obviously with long-term potential implications on their health.
You mentioned some of the things they went through. I mean, the experiences of previously released hostages, the physical, mental, and emotional torture that they endured is hard to even wrap your head around. I know that you have talked about full rehabilitation. That's the goal, to do as much for them as you can. Where does it start? What is that process like?
Well, they were dehumanized by Hamas. And this is a multi-organ and systemic assault on their internal identity as human beings. So now slowly, together with the families, and this is the most important thing, the reuniting with the families, as you see in these emotional pictures, getting back to be fathers, son, brother, and to be able to eat not only the nutrition they need, but also to sit at the table with beloved people, to eat warm food. This is crucial. It will take time. You know, I know with released hostages, even 1 year after release, they still have nightmares. They still have all kinds of problems. So the process is gradual based on their needs, need a thorough assessment. What we saw previously, that the hostages' recovery and their families was delayed because of the concern for the remaining hostages. This time, on the one hand, there are no more known living hostages in Gaza, except Tamir Nimrodi, whose fate is unknown. But I can already tell you that the hostages are occupied now also with the fight to return all the remaining hostages, including 24 that are still in Gaza. Hopefully, 4 will be brought back tonight. So that's a challenge we will have to address in order for full recovery.
They've also been cut off from the world. Most of us can't put down our phones for an hour. They haven't had any of that. Now I understand there's a welcome kit from the Israeli government. They get a laptop and a mobile phone, among other things. I'm curious if there's like a question that they ask most, besides maybe of their family, how are you doing? And is there a risk of information overload, so much coming at them that they've missed for more than 2 years?
Definitely. It's a flood. It's actually pretty dangerous because they need to hear all kinds of news. One thing that many of people they know were murdered during this time, especially people that come from the kibbutzim in the south. So they knew one side of the picture, what they have been through. Now they realize that, you know, Nir Oz and Be'eri suffered so many people murdered, so many people wounded, sometimes their close family members. They also need to know, and that's very interesting personally, what happened to their family. They realized that over the last 2 years, their family and broader family life was on hold because they are busy in the fight. They are not completely aware of the fight of the family and the public. And, they became international figures. That's something to understand, that your private life was so much exposed. And of course, everything that happened, one of the hostages, his brother, explaining what is ChatGPT, because he was kidnapped before it was so popular. So they have a lot to catch up, and it could definitely be a psychological burden. So we need, their families, who knows them the best, needs to see how they tell them the news and they can able to digest. I can also tell you as a physician, it's also an opportunity to change of some of your maybe bad habits from the past, like smoking, or as you said, being addicted to the social media. They can do whatever they want, but they are not coming back to what they were. They are coming back to a new self, and that's the future. Who knows what will become of them? Many of them could be leaders because their resilience is outstanding, and I'm personally inspired by them.
We are inspired by them. We are inspired by all of you who have taken on this work, and I know it's not easy, physically, emotionally, mentally. So thank you for that. And thank you, Dr. Levine, for coming on the program.